Hi, my name is Jenny Pham, and this is my internship report on Fairgrove Primary Health, which is the agency I interned at in fall of 2022. This semester, I interned at Fairgrove Primary Health in Hickory, North Carolina. This is a picture of the front of the clinic. The reason why the clinic looks like this is the patients that we serve prefer more privacy when they come and get their health care. This clinic is a Ryan White Health Clinic, which is overseen by the Health Resources and Services Administration, more commonly referred to as HRSA. The goal of HRSA, in conjunction with the Ryan White program, is to improve the health outcomes and achieve health equity through access to quality services for individuals living with HIV. These clinics are separated into regions in the state of North Carolina, and I interned in Region 2, which is right here. That region is responsible for the target population in 9 counties. Fairgrove Primary Health provides healthcare and medical financial aid to people living with HIV and also serves as an infectious disease clinic for Catawba County. This agency is privately funded by patients for the infectious disease side of the clinic and also publicly funded for all services related to HIV care. This is all overseen by HRSA. The Ryan White program directly allots Fairgrove with 2 types of funding, Part B and Part C funding. Part B fundings are allotted to all states within the United States, while Part C fundings are allocated to local communities like ours. There is also a Part A funding. However, those are allotted only to metropolitan areas or metropolis areas such as Charlotte or Raleigh area, where there's a higher dense population in one area. Fairgrove also generates its own funding to be used in the program for HIV medication filled in an associated pharmacy connected to the clinic. The pharmaceutical companies gives the clinic a rebate on the medication sold due to the clinic qualifying for the 340B drug pricing program, which is on screen, which requires drugs to be sold at reduced prices at eligible establishments. While at the clinic, I had the opportunity to shadow many different practitioners. These are the 4 practitioners that I had the opportunity to shadow. But the clinic, including these professionals that I shadowed, which are the infectious disease medical doctors and nurse practitioners, I also worked with many CMAs, case managers, program managers, therapists, billing and technology specialists, and front desk personnel at the clinic. My responsibilities at the clinic heavily involved reviewing patient requests for healthcare services, such as needs for new eyeglasses or dental needs, and approving them. I often worked on auditing patient charts to find patients out of care by reviewing their last HIV viral load tests. They are supposed to have 2 a year, and I would find patients who haven't had one within the last 6 months and hasn't had a in-person clinic visit, which they are required to do to be in care with us at the clinic. When I have compiled that list of patients, I send it off to different case managers to initiate contact with the patient to restart their HIV care. During my time at the clinic, I also had the opportunity to work on several budget reports to be sent to HRSA to stay in compliance with the program. My specific approved internship project was a survey that I conducted with patients at the clinic to find new methods to increase patient engagement in their care. On screen right now is the survey that I had created after doing research on different methods and different programs that were available across the United States. And this was provided to our patients for them to have a voice in what kind of programs that our particular community needs. The survey was conducted over a course of 5 weeks in the waiting area of the clinic as that was determined to be the best method for data collection with this population. Surprisingly, the results indicated that patients are extremely interested in a program focused on cooking and nutrition. With this information, the clinic is intending to proceed with program development for a cooking class with the local community college. This project had allowed me to research methods that are utilized at other clinics on a national level, which demonstrated my competency in the role and importance of data in public health. It also and also the creation and implementation of the survey demonstrated my competency in project implementation. And lastly, compiling and evaluating the trends in the data allowed me to demonstrate my competency in identifying and addressing populations in public health. For me, while at my internship, the most valuable thing I learned during my time there was how to navigate through state regulations and patient insurance to help them get the care that they needed. Oftentimes, while the program itself would want to approve for the services that these patients really needed, we would often find barriers to their care. And a big part of my job while at the clinic, was talking to different officials to work with them to get the care that our patients needed. For example, if one of our patients is not able to cook for themselves, we would and they couldn't access any of the local programs that are in place because they didn't meet qualifying criteria for them. We had to find a company that was willing to work with us at reduced prices to give hot, ready-made meals for this patient who could barely microwave their meals, or let alone cook, like go get groceries and cook for them. This process took a very long time, and it took a lot of back and forth with different legal teams on both sides, including our agency and a company that we were hoping to establish a collaboration with. And in doing so, it delayed the care of this patient by weeks. And unfortunately, his health deteriorated because of it. And this is a very common problem when it comes to working with the public. Even though our program had a lot of funding, it is often very delayed giving out due to patients not meeting exactly all of the criteria, even though they are a patient who are desperate for these healthcare needs. The thing that I liked most about my internship was the people that I worked alongside with. They worked very hard to try to meet the needs of this population as best as they could within the bounds that they were given by different entities in terms of their own legal team, as well as the state, as well as different insurance companies, and on what they were allowing the patients to access. And we had to find creative ways to kind of work around that constantly, all the time, with our population. And the thing that I disliked most was actually doing just that, which is working with other legal teams to try to get the care for a patient who obviously really needs it, and just how much bureaucracy was standing between them and getting the care that they needed. And my most memorable experience was heavily involved in talking to different legal teams to get that patient the meals that he needed. And I think it was one of the most memorable because we did successfully get him the hot meals that he desperately needed. But unfortunately, it was a little bit too late, and his health did deteriorate a bit quicker than anybody had intended. Closing remarks. My internship was very eye-opening in terms of how much insurance plays a role in many people's healthcare needs. Ours is particularly special due to it being publicly funded. And so a lot of our population can't pay for most of these services themselves. But me as a professional, I have to keep this in mind in the future if I'm going into the healthcare field, that not everybody has the same team as the one that I worked with, where they would be able to get all of their needs taken care of. So, thank you.